And welcome to the Merit Education Rounds. I am Dr. Elif Bilgic, and I'm an education scientist in pediatrics and Merit. So Merit program is an education services program in the Faculty of Health Sciences with a vision to grow a community of scientists and clinicians to advance health professions education through research and applied science. Now, as a part of this vision, the Merit has created a visiting professorship that invites prominent scholars with expertise relevant to health professions education to engage in a part-time year-long residency at Merit. Now, the goal of the visiting professorship is to build a particular knowledge base, skill set, or capacity in the Merit scientists and community. Now, we're very excited to be hosting Dr. Cheryl Poth this coming fall for a series of visits to McMaster over the course of 2 years. Her portfolio will bring a diversity of quantitative and qualitative methodology expertise in acquiring improved competence in mixed methods methodology research. Now, before I say a bit more about Dr. Poth, who is also today's speaker, I would like to make an land acknowledgement. Now, though today's education round is virtual only, many of us in this event are connected by the land on which we work. So I take this time to recognize that McMaster University is on the traditional territory shared between the Haudenosaunee Confederacy and the Anishinaabe Nations, which was acknowledged in the Dish with One Spoon Wampum Belt. The wampum uses the symbolism of a dish to represent the territory and one spoon to represent that the people are to share the resources of the land and only take what they need. Now, before leaving the stage to our esteemed visiting professor, I will provide a very brief introduction. The title of today's educational round is What Can Mixed Methods Offer Health Researchers? Now, Dr. Cheryl Poth is a professor in the Center for Research and Applied Measurement and Evaluation at the University of Alberta and was a founding board member and president of the Mixed Methods International Research Association. As more and more researchers are interested in using mixed methods research, Dr. Poth's talk will help us understand why mixed methods research should be used and how we could design a mixed methods research study. Now, during the rounds, feel free to use the chat for comments and questions. We will have a Q&A period at the end, so you can ask your questions by using the hand-raising function or through typing in the chat. So without further ado, Dr. Poth, please go ahead.
Oh, wonderful. Well, thank you very much for the lovely introduction. And I had shared that I can't see the chat myself while I'm sharing my screen, but I do have, thank you very much for offering to moderate, and we will go from there. So feel free to interrupt if you need to, and if not, I will address the questions at the end. I am so pleased to be here with you in this virtual world from my home in Edmonton. Today, as we embark on the journey of discovery and learning about mixed methods, I would like to also begin by acknowledging I'm currently situated on Treaty 6 territory, which are the traditional lands of First Nations and Métis people, whose presence continues to enrich our vibrant community. I hope as we journey together that you might and will connect our discussions with familiar ideas and spark new ideas about how we might design health research. I want to thank Jonathan for the opportunity to begin our work together, Samantha for ensuring we're all here at the right place, the right time, and others like Alifi who make our work together possible. From today's discussion, I hope you will get a sense of what distinguishes mixed methods from other types of research, who I am and my approach to mixed methods, and most importantly, how you might leverage mixed methods in your own work. My intention is for us to build excitement about the possibilities of what's to come. I like this image, first because the colors remind me of spring and the possibilities that come from a new season. And the paint also that it represents for me a bit of a scene of organized chaos. And I think this represents how I like to approach this discussion about mixed methods. So let's start with, why are we here? Why are we even talking about mixed methods? Well, mixed methods seems to be everywhere these days, but not just because it's popular doesn't mean it should be done. But of course, let's see a little bit of evidence specific to health. This morning, I did a search of 2023 different health ones, and here are some things that I came up with. Notice that all their intentions are different across these headlines of just published research. The populations that are studied vary. The configurations of the research teams are different sizes, different expertise, and that you can see that naturally their impacts will be different. So what are their commonalities? First, the use of mixed methods in all of their titles. Does that make it mixed methods? You'll be surprised to see how many papers I read, proposals I review, and committees I serve on, where what we are talking about does not actually meet the criteria of mixed methods. So let's start with creating a shared understanding of what is mixed methods. Now, I want to give that efforts to define mixed methods have been replaced by key characteristics. And I rely here on some of the work of John Cresswell and Vicki Plano-Clark on defining the characteristics. Between you and me, with the explosion of different data forms, I predict a future where we no longer categorize data in the qual-quant dichotomy, but that is for a totally other discussion. For today, we're going to keep talking about the qualitative and quantitative categories. So here's what distinguishes mixed methods. In mixed methods, the researcher collects and analyzes both qualitative and quantitative data rigorously in response to research questions. I want you to notice here the idea about rigor. It means that we actually have to meet what some of the standards of each, both qualitative and quantitative, and that we should see research questions that cannot be answered by qual and quant alone. You may not be surprised that most publications do not represent mixed method specific research questions. So this is a skill that we want to build, because without relevant research questions to guide the design of a study, we risk designing a study that does not require or call for mixed methods. And that's where sometimes we can see the difference between multiple methods and mixed methods. The second characteristic, it integrates, or we can use the words mixes or combines, the two forms of data and their results. This means that we should see something other than separate qualitative and quantitative data and discussions. Where and how the integration happens can vary considerably, and we'll talk a lot more in a moment about what constitutes mixed methods, what I call mixed methods light, and more advanced, or what we call fully integrated mixed methods. That the researcher organizes these procedures into specific research designs that provide the logic for conducting the study. I am sure at least some of you have encountered designs that have the label mixed methods in them. Indeed, this is an important part of the last 2 decades. It's like other approaches to design that these designs have played essential roles, but they have not been without risk. One of the reasons I wrote a recent book was to provide guidance for researchers whose research did not fit within these typologies that have come and become popular. Interestingly, I also appreciate that there's a movement now, beyond those typologies, because I think that will actually help us to be more innovative in our thinking. And finally, frames these procedures within theory and philosophy. I'd like to extend this a bit to also include lenses, conceptual frameworks, approaches to data, and even approaches to research, community-based, patient-oriented. And the idea that these are various frames and orientations that influence decisions and that we will make these explicit. So I have long recognized that researchers do not come to mixed methods as blank slates, and that the building of mixed methods research capacity needs to build upon these experiences and expertise because they influence how we come to mixed methods research. But it's also important for us to realize that it's not enough to have simply qualitative and quantitative expertise, that there actually is something special around the integration piece that requires, and we are still developing and identifying what exactly do we need to know in order to do mixed methods. But I really like this idea about having the qualitative and quantitative knowledge in a dynamic and deliberate conversation with each other. Yet we're also acknowledging who we are as researchers and that we build upon those skills. So what might help you actually do this? Well, you can probably imagine that there's lots of benefits with popularity, but with popularity also comes downsides. Among the many challenges is that demand for mixed methods research capacity far outpaces availability or our current ways of being able to respond to that. Also, the rapid pace of development within the mixed methods research community and literature means that keeping pace is necessary, but hard for many practitioners and clinicians. As a result, I see a lot of older literature cited and practices that are no longer considered current in the things that get published. And because part of that is the lack of expertise. By the end of our time together, you'll probably know more about mixed methods than some who are actually doing mixed methods. I myself is what's called a first generation instructor of mixed methods. This means that I did not have formal training in mixed methods, and that when I started the first coursework in mixed methods at the University of Alberta a dozen years ago, that I was a pioneer. And still today, demand is such that the courses that I offer fill within the first 12 hours. So my approach to teaching mixed methods has greatly evolved. I no longer, teach mixed methods in we should come up with a problem, then we design it, because the world is more complicated than that. And as you'll see where I leave you today, is you might be coming into the design of research with perhaps your participants that you want to study, or perhaps the topic you want to study, or perhaps the site in which you want to study. And we can work out the other details, around the things that we know. So one of the key challenges within mixed methods is successful integration. Oh, and if we don't talk about integration from the get-go, then it's probably not mixed methods. So I now teach mixed methods, beginning with conversations about integration. Why do we need to integrate? How are we going to integrate? What are we going to integrate? And then what will that look like when we do that? So this is one of the first things. We're going to go back through those 4 pieces, those 4 characteristics, and then we're going to talk about what some of the skills are that we're going to build. So in this first one around collecting and analyzing this data rigorously, that we need to build skills in demonstrating evidence of integration. And this is one of the things that I look for in the things that I am reviewing and doing, because if you can't say why we need to do mixed methods, then it's probably not mixed methods. The figure to the right is from my 2018 book, in that it represents some of the common reasons we do mixed methods. So for example, corroboration, when a single data source is not enough. Completion, perhaps it's like a jigsaw. We need the qual in order to, with the quan in order to understand something more fully. Perhaps it's to explain. We see trends that we talk about contextualizing quantitative data. Perhaps it's that there isn't an instrument that exists. So perhaps we need to explore first, and then we need to develop a protocol or develop an instrument. Or perhaps it's that we need to infuse the ways that we do research in a particular way. And then one of the things that I've added is innovation. Do we actually need to know why we need to integrate, or just that we need to integrate, and that we'll figure out the actual reason? And maybe it's for innovation that we haven't done this before. Perhaps that's enough as a reason in order to integrate both qualitative and quantitative. Let's go to the second characteristic. We need to demonstrate skills, demonstrating evidence of integration in how we represent or display our findings. So certainly we can use separate qualitative and quantitative tables and only integrate in our discussion. But experience tells me that often when researchers do that kind of parallel, that they don't do the last step of the actual integration. So one of the things I do early now in conversations, I actually ask folks, what would a joint display or an integration table look like for your study? And right away, when we talk about integration, folks are like, oh, can I integrate it? How would I integrate it? Is it possible to integrate those data sources? Does it make sense at the unit of analysis of where the data is from? Would it make sense for me to integrate, health systems level data along with hospital data? Or how would I actually go about that? What would it look like and why? So when I ask this, it requires us to think about this kind of integration, this idea. And so this is an example of a table that is what I would call a beginner or a place to start in this kind of a table. So what you'll see on the one side is you'll see kind of the quantitative results. On the other side, you'll see some of the qualitative results. And what would, if I can kind of make this table even better, would be one more column around what are the mixed insights or the integrated findings that I am interpreting from these two pieces together. Why can I do that? And so we're going to talk a lot about those kinds of things, about how do we display. And there's lots of really fascinating ways to visualize data. And, from GPS data to, to trends, to using lots of great visuals. The third characteristics that we're going to just revisit for a second is we need to build the evidence in demonstrating the integration of our procedures. In the Journal of Mixed Methods Research, of which I serve as an associate editor, we now require design diagrams. Design diagrams are a great way of putting a lot of information in a small amount of space. Because of course, when you're publishing mixed methods studies, one of the challenges is the space allotment. This makes clear where integration is happening. And integration can happen at multiple places. We've already talked about where it can happen at the end, at kind of the discussion, but it can also happen during the data collection and even within the data levels. And we'll be talking about more examples over our time together about how that might look like and why you might want to do it that way. So in this one, I've just given two what I would call more basic designs that are forwarded by John Cresswell. And so in the one to the right, you'll see that where it merges and compares. You do your qualitative data collection and your quantitative data collection and your analysis separate, and then you bring it together at the discussion stage. And so that would be what would be called a concurrent design. And often that's when you're trying to compare and contrast the qual and the quan. And then on the bottom of the screen, it shows a one that is a little bit more linear. So that's demonstrating a design that is more sequential. Perhaps you would do your quantitative at first, and then you would follow up with your qualitative. Of course, that can be opposite as well. You can also have more complex designs where maybe you have a sequential design with a concurrent piece to it. Maybe you have a mixed methods program of study where you actually have qualitative studies and quantitative studies embedded within it. So that is one of the things that John and I have talked a long time about, that he never meant for his typologies to constrain the ways that people think they can do and organize mixed methods. What happened is that there were many typologies that were being developed over the last 2 decades. And interestingly enough, one of the typologies had like 32 different typologies, where John's had 4. And what you'll see is that the Cresswell and Plano-Clark designs are the most popular designs that are kind of cited in research. And I think part of that is because they were really good entry points. He's also now identified some more complex designs as well. And sometimes we're actually revisiting some of the other typologies that I don't think ever kind of got their due for kind of their usefulness now. So I feel like in mixed methods, we needed a place to start. And then now I feel like the designs are actually reopening again in that way. So one of the things that I see folks getting very concerned about is actually this idea about integration. And this is where I want to alleviate any concerns, because you can start, I like to see integration along a continuum of intensity. And so lower intensity does not mean lower quality. It simply means that perhaps it's where I'm starting. And so I like the metaphor of sprinkling. So I want you to imagine this. You see a publication and you're looking through this mixed methods publication. And perhaps what you see is quantitative relationships that are, so you can see those, maybe you even see a separate table. And then with that, you see some qualitative data and some themes that are kind of sprinkled into it. So you can still separate the qual and the quan, but that they are being integrated. And then the discussion is based on what those new findings that are coming out of there. So what you can see is that might be kind of considered a little bit of the lower intensity, where perhaps as we move up the level of intensity, when I look at a publication that perhaps has no separate qual and quan findings, instead that they're actually maybe organized by mixed insight themes. That is a little bit more tighter woven, a little bit more intense in the integration. And then I would consider that just a little bit, and then it's a little bit harder to, if I can, extract the 2 data points. And then this idea about the fire is, I think, where we're still going. And it reminds me in a chemical reaction, where you put together two pieces and you get something completely new. And that could be something like along the lines of, if you are mixing at the data level. And so perhaps you actually never do analysis of qual or quan. Maybe it's the analysis of this mixed data. And so I think in the next decade, I think most of the publications are still in the lower end. I think we are moving towards more weaving, and I think we're going to see more and more examples, I hope, of what I say even higher integration as these different data forms kind of come into play. So that's a little bit of my prediction into the future. This last characteristic I want to revisit because I actually think it's where we have the most development to do. And I don't think we talk enough about the role of theory, the lenses or orientations to mixed methods. And this is an area of which I'm really interested in and that I will ask you to engage with me to think a little bit about. We need to build skills in making clear the influences to our study. This is a way that I think about that we will enhance equity in our study designs as we unpack our personal and systemic biases. And I'd like to tell you a little bit about the journey I've been on and my realization about the threat of data oversimplification and the implications for equity in our designs and in our existing data sets. And so for me, I can trace back my interest in mixed methods to the humble fruit fly. And perhaps my story will help you think about what orientations, lenses, and experiences you bring to your research. And so you can begin to consider other designs, including mixed methods, in data possibilities for integration. Folks are often surprised to hear that my initial training was in the natural sciences, and that I spent several years thinking about the world as being able to be reduced to some variables that we could manipulate and study the effects. I remember a particularly time-consuming genetics lab where we bred fruit flies to examine how traits are passed on from parents to offspring. As I know many of you can relate, this experiment required many hours in the lab to count on how the genes were expressed themselves in various ways in our fruit flies. While the work was onerous, in many ways, I miss the simplicity of that study these days. This is because in the studies of fruit flies, I did not have to account for the influences of the healthcare system on the well-being or the home life of the fruit fly, or how many services they were accessing and the barriers that they faced. I had no access to health system data of the fruit flies or how my group of fruit flies compared to those in another class, hospital, or jurisdiction. I had the luxury of literally studying them in blissful isolation using counts of a small number of variables. Now, this was not easy. It's not easy to decide the color or the shape of the wings, but we did our best. But with several of my group, I have no doubt that the reliability of our counting was a little off, which I can now better appreciate the impact of our inferences. It's probably a good thing we were not making huge health programmatic or policy decisions based on this data set for the worldwide population of fruit flies. So how does this example illustrate the challenges that we face when we're studying people embedded in multiple nested systems that are constantly being influenced and are influencing? So I started thinking and writing more about how the lenses that we use to conceptualize the phenomena we're studying matters. When I used a lens like I did for the fruit fly, I knew that I wanted to study and that I simply studied it and justified my lens based on existing literature. Yet I wonder what I missed because of that view. When I use the term lens, I mean in the broadest sense. I mean, including the researcher worldview, the theoretical orientations I bring, it all matters. Let's imagine a health research problem with no known solutions or established methods to inform the study. Perhaps something like, how do we go about enhancing equity in our healthcare system and close care gaps? Simple question, right? Would we place it along the simple category? Sure, we could, but let's look at those implications. I think about what it tells us. And if we want to address a complex healthcare issue, that we knew a new way of doing it, and the path is not yet clear and it's ever changing. What I think is really interesting is that mixed methods is well positioned for designing complex health research questions because of its inherent methodological flexibility. We can pivot if we need to explain, explore, compare. We might do studies, like I mentioned, in a larger program of research of mixed methods, but that are qualitative or quantitative in nature. And so I'm sure that you are familiar with the different ways of doing, the simple, complicated, and complex, but this is just a quick reminder. This idea about simple is this idea about following a recipe. I think about that in terms of following established methods of, perhaps protocols that are more linear in nature and that we have to follow them. Then this idea about sending a rocket to the moon requires us to be thinking about, the air, the speed, the current conditions and how they changed. And of course, raising a child is the idea of the example of, in a family, you can have 3 very different outcomes, with the same parents or the same genes and all those different ways of expressing. So we take it back to research. One of the challenges that we have is that if we choose to study one aspect of the healthcare system in isolation of others, then we're recognizing less of the multitude of interacting influences. In the literature, this is sometimes called a simple view, but not because it's easy to do, but rather it reflects a reductionist perspective. We've all seen studies where researchers focus on only 1 or 2 constructs, often for practicality or feasibility reason, and they often will uncover important understandings that can be built upon. Yet in the limitations, they talk about the findings being limited to the scope of the study. I've had a lot of conversations, and myself, I even look now, I like reading limitations of studies, and I like imagining how could the study have been feasible, but yet not limited in the same ways that the researchers are claiming that they didn't have, that they did. So one of the challenges is this idea about, can we think about data collection, and can we, think about how we use our resources in a different way? So if we did this, we might choose some variables, perhaps databases that have been collected by individual researchers or hospital departments that may be useful to them, but necessarily transferable. I certainly, again, do not mean to say that this is easy, but it's usually narrowly focused on that. So some would argue that we have had limited success in addressing such complex health problems when we reduce the phenomenon to a very few. But sometimes we actually have to start here in order to know how we can, take a broader view. So as researchers, if we choose a more complicated lens to study some of the multiple interacting influences in the healthcare system, that we're recognizing some of the complexity that exists in reality. I'm sure we've all seen studies where researchers discover new aspects of existing understandings that can advance practice. Yet again, in the limitations, I talk about the findings as being limited to this larger scope. If we expanded our data collection to maybe include more perspectives that are feasible, there's always those trade-offs. And one of the things that we have to do in mixed methods is to think about, what is the relationship between our data sets? What is the relationship between our samples? I recently reviewed a proposal for a study that had what we call a match sample. So they had a population of 500 who were answering a survey, and then they were going to interview the 500. And there was no rationale for why did we actually have to interview all 500? Could we not have sampled it in a way that made it so that you could also have a very tight and rigorous, but yet also be kind of feasible? So perhaps, we want to collect things in a different way. Perhaps you can't do this alone anymore as an individual researcher. Perhaps as we get more complicated, we have to put together a team of folks that's going to allow us to rely on different kinds of expertise. Then once we go to complex, if we as researchers choose to adopt a complex lens, then we're recognizing that we don't understand many of the multiple interacting influences. That we're in uncharted waters can be exciting, but also uncomfortable. Largely because I think funding agencies expect researchers to know what they are studying and how they will do it. I've had a lot of conversations with folks who feel limited by this. And I hope at some point, and I see some of the changes in the kind of funding requirements as well, that in order to really tackle these big health issues, that we're going to have to recognize this idea that we don't quite know how to do it yet. But it's amazing when we bring together folks who bring different perspectives that we can begin to draw on expertise, perhaps not just from healthcare, but also the social sciences and humanities, as we see lots of interprofessional teams going on. This means that as mixed methods researchers, we have to gain comfort with uncertainty, that we can assimilate understandings as they emerge. Little did I know how this interest in complexity and the application of complexity theory would change the path of my career. I feel fortunate that I've had the chance to support research teams in conducting research using mixed methods, as well as to advance the practice and teaching of mixed methods research. So I've written about the application of complexity theory as a lens for mixed methods research, as well as conceptualizing the processes of mixed methods research as a complex adaptive system itself. This helps me to make the case for why we don't actually need to know everything about our design before we start. So I hope that that actually gives you some comfort. So in our work together, I'm going to ask you to think outside the box about what has been done and to think about what needs to be done, even if we don't quite yet know the procedures or solutions. In fact, this is what's interesting. Of course, we may have to take a step back and go, this is where I want to start my program of research, and maybe this is where I want to end up eventually. But there's a great deal of possibilities that have yet to be explored, as well as designs to be followed. Perhaps you have an inkling about a population that needs to be studied, or study limitations that you've read about that you want to address. I invite you to consider what kind of entry points you know and which ones you're still figuring out. In my work in mixed methods, I have seen folks do studies that a year or two ago could not have been done, perhaps in a very small incident population, perhaps using methods that hadn't been used before. And so we're going to investigate those kinds of things. And perhaps, I mean, I myself have thought about a study based on population and had to seek somebody with more arts-based methods expertise than what I had. So that's the whole idea too, that we sometimes don't even know what kind of expertise we need to do in order to have this. But in mixed methods, it gives us the idea of thinking about and even matching how we think data should be collected with the population in which we're working with. So I ask you to think about these 7, I call them entry points to research design in general, and I would say in our mixed methods work. So think about, as a researcher, what are you bringing to your study? What preferences do you have? What experiences do you have? So it is perfectly fine to say, in somewhere in my research, I want to do a survey because this is what I know. We can talk about how, what role that survey might use in your research, but that doesn't mean you can't do it in that way. What is your research purpose? What need does your study address? And why do you need integration? What is your research purpose going to gain from the integration? Perhaps you might want to use words like, I want to explore, I want to explain, I want to develop. We can figure out what that mixed methods purpose is. And then your research setting, maybe this is your entry point. Maybe you know where you want your research to take place and you're still figuring out the other things. Or maybe the research setting, you don't even know yet. Maybe you don't know where to find your population yet. Maybe that's something that you have to figure out. And maybe you might want to start with the research participants. This is the population I want to study, or maybe you don't know who they are yet. And then these data procedures, you might have data procedures in mind. You might have existing data that you want to use. And then we have to figure out what are the limitations within that data set and what does it tell us and what does it not? You can certainly use that as your springboard as well. And then we want to think about who is the audience for our study and perhaps even about what do we want to change? Is it practice? Is it policy? Is it knowledge base? So all of those entry points can help us too. And then for some folks, the theoretical frameworks is where you're going to start. It is imperative that from our research participants, we do a community-based approach. Or for my patients, I have to, or for the work that I want to do, that I'm going to use a patient-centered approach to my research. Perhaps it's very important for us to have a randomized control group in there. So those are the theoretical frameworks that you might use, or you might use a gender-based analysis that we want to see, is the care different for across different genders. So we can look at that as well as different places to start. So what I'm hoping that you can do now and over the next bit before we see each other again in the fall is to actually think about, what are you interested in studying and why? What study purpose might integration serve? Where and how might integration occur in your study? And what challenges do you anticipate? If you have a study in mind, let's think about how it could be framed as a mixed methods. And that will just even maybe help you if you decide to do more of a qualitative or quantitative study. There are different ways that you can have different priorities that you give qual quant. It doesn't have to be equal. And we can talk about what the implications are for how we go about maybe a more quantitative focused or driven or led study in mixed methods or a qualitative one. And so the possibilities are really endless around mixed methods. It really is a wonderful place to start and to think about. And sometimes people talk about that by learning about mixed methods and about the skills necessary for integration, that we actually will help us to even build maybe our qual skill set and even our quant skill set, and also to identify and working with people who bring different skill sets as well in the mixed methods can be really a lovely professional development around understanding different skill sets as well. So I'm going to pause there. I see that the chat has not been very active.
Yes.
But that's okay. Sometimes people are percolating in their ideas. And so I'm just going to stop and pause and give folks a chance to kind of make some comments.
Cheryl, thank you so much. I think you've really taken a domain, mixed methods research, that I've struggled with. And I'm going to ask a question that's going to probably make it sound a little foolish, but it's the question I really struggle with around, and I guess I use the concept of a conceptual framework, putting together the argument of why and how I'm going to build that argument. And I wonder, is it possible, because as a self-proclaimed post-positivist, I'm recovering from that positionality. I wonder, how can I mix different philosophies, different epistemologies? I have a natural proclivity towards the experiment, and yet as I've been able to collaborate with a number of individuals and start to use more constructivist philosophy and understand how we can build a shared meaning, I struggle with how to put those two different orientations together in my conceptual framework, and then say, well, as a result of how I'm making my argument, now I know the method. Now I'm going to do some kind of quantitative analysis of this data, but I'm also going to construct meaning from a different meaning. And then how do I put that all together into a coherent piece? I'm sure that it's loud, but I'm sure that I'm crossing over the median here many times when I'm doing it. So could you unpack that problem for me? I think that's the point that you started with. You really have to think about how to integrate, and I'm struggling with how to integrate those very different worldviews into a cohesive, here's a narrative and here's what it means.
Well, I mean, it's a great question, and I don't have a simple answer for you, other than one of the things we can do a little bit is unpack a little bit about, why do I think the way that I think? And maybe that gets very philosophical, but we are influenced by the people who we trained with. We're influenced by the research that we give weight and meaning to. We are influenced by the policies and practices and the world in which we have come at. So part of where that is, and when I watch folks struggle, and it's been super interesting to watch and to be part of the kind of the conversation as we changed. 15 years ago, we had a little bit of a default statement. And I would say, well, I'm a pragmatist, so it doesn't, none of that stuff matters. It's about that I have a problem to solve and I need and I can come up with a practical problem solving. And by looking at these two things, I can solve the problem better. Now, that's, to me, we have a better understanding of, to be honest, some of the challenges of that. It's kind of skipping over. There's been some great writing about the duality and how we can actually live in these two worlds, but still kind of integrate. And some of it is, I like to think about this idea about, what does your gut tell you? When you're reading or when you're doing research and you're reading or you're writing even up something, and you're like, is your gut telling you, that sometimes the patterns, that maybe you're seeing in your quant data, that there's more to a story to behind the scenes. And that there's this, and that's where I'm seeing a lot of folks who used to do, intervention studies that was simply, the kind of clinical, and they're like, no, the patient experience is important to include. How can we ignore the patient experience? How can I recommend a treatment plan without that idea of understanding that as well? So part of that, I think, comes at that, what else is needed? I think sometimes the struggles that you talk about are that we just didn't know have a way of being able to justify, so we're talking about the conceptual framework. It might be, that another perspective is necessary. And that's where you come at this. How have I done so far in terms of what you were hoping for?
I'll give you a bit of a worked example. We've just finished a study on imposter syndrome. And so there is a validated scale. And so we collected a lot of data from probably the largest sample from a single institution, McMaster. And so we know how people score, and we can do an ANOVA to say, what are predictor variables for this? Gender, age, whether you're single or married. And so we're trying to explore the data. And that assumes that there is some predictor, that there's some kind of universal truth with a standard deviation around it as to what it means to be an imposter syndrome. But now that we're into the data, we were like, well, we'd really like to talk to people and see how they experience and manifest it. And the type of data we have is very blunt and it's not rich in the kind of way of what the heck are we actually measuring here? When people are filling out this scale, even though there's 30 questions on it, what are they actually responding to? What does it feel like? And so the question is, should we have been a little bit more thoughtful and worked through this and built in a part A and part B to our study and gotten two different pieces of data and had kind of the post-positivist, here's the analysis, here's the dependent variable that explains variance, and you can predict if you are in this demographic, you might go here. And the part B study is, what does it look like and feel like to be an imposter? Or should that be part of a program of research, a study A and a study B? I think separate as two different papers in two different journals, you'll lose the thread and the richness of what we're doing. So we're struggling. This is the real work example of where we're struggling.
It's an excellent question, and the struggle is real, and that we can always have hindsight to these things. So if I can, I'd like to take advantage of your example a little bit, because it actually highlights kind of some of our past practices where people are like, even when they're talking about, I now will do a knowledge mobilization plan before I do a study. And we'll talk about, what are the papers that could come out of this? Because one of the challenges is even when you're doing mixed method study, there was a piecemeal, kind of idea. Can I publish this separately, and then can I still publish something together? And my answer to yours is, should we have done something differently? Maybe, but your study is perfectly fine. But what I hope we can bring a lens to that now is, let's talk about that validated scale. And this is where I get into my measurement world. And I think about, to whom was that validated with? Is it still valid in this day and age? And is there an opportunity there? I mean, certainly we're constrained by kind of what we've done, but even I think there's even a sampling, discussion about who did we sample, who did we talk to? Are there some interesting, subgroups that maybe we can find some nuanced things? Can we actually, out of this, could we take a look at what the scale is telling us and what questions are lingering of that? So I actually think mixed methods can play a really important role in helping to improve some of the scales that we've been using for a long time in almost this, in the 21st century kind of idea. I think it's also can help us unpack. I mean, the scales are developed based on a lot of assumptions. Are those assumptions, and are those perspectives, are the constructs, our understanding of constructs and shifting over time? And so should we have? I mean, another study, and this is where we can actually imagine 10 different designs to a study. And sometimes I think that's actually a really rich discussion to have. So for example, rather than doing a larger study of what you did, another choice or another pivot you could have been done is to do a smaller, maybe a more subsample focused, along with some qualitative, because maybe what you're going to find in your analysis is that there's a subsample for which there's some interesting patterns or that people look differently or things like that. So I think there's a lot of questions that you have emerging from yours. I'd love to talk to you more about it and about what do you think the next steps are in this kind of a program of research with that. What would help you to be able to, how could you mix that data with the next step? How could this be a beginning of a sequential? If we think about the possibilities of mixed methods at the beginning, then we can do things like get data that then, or permission in order to follow up with folks. I'm going to assume that you probably don't have the ability to follow up with folks at this time. And so that would be something of building those possibilities in the future, thinking about that.
Thanks so much. I wish you'd have been around, 18 months ago.
Well, but I also think you could look back as well. And yeah, so we can talk more about that, because of course this is not the first. But thinking about, and this is why why when I teach even research design, I talk about, where could these studies go that you can't even imagine right now, and think about those possibilities.
So I guess, Cheryl, like in a way, when we design something and then based on the results we realize, it probably should have been a different design, that there's potentially not much we can do in terms of the design. But
yep,
like, you think we can still potentially like not do a mixed methods because we haven't really designed it that way, but still somehow try to do a follow-up, maybe through a qualitative research design to explore some of that finding, but we might just not be able to call it a mixed methods, I guess.
It certainly can be mixed methods, but what
like retrospectively we can change it potentially.
Well, part of what I would want to talk about is when you're planning the next step, what's the relationship between the samples? And being very upfront about that,
right?
Because we can talk about comparison groups, right, or accounting for those kinds of things in the same way that we do in others. So I think one of the biggest things we don't talk about is the relationship of the population samples. I will read mixed method studies that have two completely separate, that I can tell, even sometimes in different jurisdictions, and all of a sudden they're wanting to integrate it, and I'm like, but what makes you think you can integrate that and get something meaningful out of it? So those are the conversations that we want to have, is around, what are the vulnerabilities to all designs have vulnerabilities. None of them are airtight. But I think it's about owning those vulnerabilities and doing the best that we can under reasonable circumstances. And what does that look like and mean? I mean, we can use census data, and then do, because that is a population wise, and then talk about why we're looking, at certain subpopulations.
Right. Perfect. Thank you. I don't see any questions in the chat. Does anyone have any questions from the audience? I feel like I might have seen someone unmute, but I don't see any unmutes. At this point, again, feel free to use the chat to ask your questions. But I think, Cheryl, something else I do want to ask, sometimes, as I'm reflecting on my past research, but also sort of future directions, sometimes I have a hard time, which you alluded to it, but, for me, I feel like any research, any project could really benefit from both data sets and the integration of it, rather than one versus the other. And the more I'm reflecting on like the things that I've published, I'm like, well, actually there could have been a benefit to gathering other kinds of data and kind of somehow integrating that. I do wonder about mixed methods and choosing, like being able to really choose between the research designs. For me, everything could be like could be mixed methods. I just sometimes wonder, maybe it's not a question but a comment, like how to really think about what could qualitative and quantitative do separately that would be valuable, versus those two coming together and really helping us provide a very in-depth understanding of a research question.
It's a great question, and I will admit that it reminds me of like all of a sudden, you know, when there was a mixed methods way of seeing the world, right?
Mm-hmm.
And I think part of it is in everyday life, we are mixing information all the time. Like I think about the idea about, and that we have different preferences. Like between my partner and I, if we're trying to decide to go to a movie, you know, he will go like the quantitative, and I'll be like, I'll listen to people's perspectives and I'll want to. But together, you know, then we can usually come up with some sort of an evaluation. I mean, so much of our world we're being thrown at with both types of data, and so it's natural that we see the benefit. It always reminds me of, it's like more is better, but that's actually not always true. I still do I do qual studies, I do quant studies, and I do a lot of mixed studies as well. But there are absolutely times when it doesn't make sense to use mixed methods and that we're actually better off. And sometimes it has to do with our audience. Sometimes it has to do with our participants. I've certainly had projects where we had intended to do mixed and it wasn't going to fly. So we've actually had to pivot into one or the other as well. So I think about this idea of methodological literacy, you know, and being able to, about matching the question to the design and to the audience, and on all of these things, that kind of works. I do see a couple of questions here on the chat. I'm just going to read them. I see David just kind of commenting that the idea about mixed methods is that we can talk about what those different things bring and even different approaches. And what I love about when we get a group together talking about mixed methods is the diversity in the room or in the projects that we're talking with each other. I always learn things about different ways of doing things. And so I do think that it allows us to talk about possibilities of research and imagine possibilities. And so I think that's really exciting, David, so thanks. And Monica says, I'm totally new. That's totally fine. And that you see this idea about imposter syndrome. And I mean, I understand it's the idea about not quite knowing what you're doing, that discomfort with it. But I will tell you, the moment that we start, you know, getting into, and I mean, the way that we learn is by doing. And so we don't have to do a big massive project, just do a small project, do a small integration. And it's kind of like, you know, find your legs in mixed methods, find your confidence. And then you will go to a conference or you'll publish a paper and somebody will say, you've done something that nobody else has done. And you'll say, that's why it was a little hard, right? Is because you're out there a little bit on the edge. I've had several colleagues who 10 years ago said that mixed methods would never be part of their field. And each one of them has come back and said over the years, I was at a conference, there was a presentation, or, you know, I've just seen something published. What you're also seeing in your own areas is take a look in the journals in which you use. Is there a beginning, you know, mixed methods, you know, guidance in those journals? I mean, one of the things that's really lovely about getting into mixed methods is that we can always find a methodological contribution when you do mixed methods. Is it the table that you've produced? Is it the insights? Is it the way that you've done something? Is it the theory? And so that's a really exciting, and that's what people then start to see, where they can publish their findings, but then they can also publish and talk about methodologicals, and that can be something new for a lot of folks as well.
Sounds good. Thanks, Cheryl. Any other questions or comments, everyone?
I'll steal the last 2 minutes if nobody else has one. I already feel like I asked a question, so I feel like I'm being overly excited here, but also expressing my struggle with it. Again, this is kind of I've been reflecting on your answer about how to think and plan through at the start. And do you start inductively and move to deductively, or inverse, or does it matter? Because where you decide to start to see the phenomenon will tell you about, all right, whether you want to validate it with the inductive approach or validate it with it. Like, so I also now start to worry, well, where to begin, because I could unpack. I guess it's the conversation of the research team would be the understanding, and without a specific problem to work through you don't have, but is there a typical start inductively and move deductively, and then see what type of method you want to use, or what?
So it's funny, my process has completely changed. And it's probably emerging. Just at a conference recently, I did a workshop and engaged folks in actually drawing their what they think their research, the environments around what they're trying to do, their phenomena, and then coming to and then how would we collect data that would help us understand that phenomena, and making these like really intentional decisions. Oh, but I'm going to use that data because that's existing. That's fine, but actually, and then seeing, so if I want to integrate, am I integrating across what we call, like almost like data levels, like person, groups, and then being very intentional about, well, that's what that can do, but I'm missing data now to explain this part of the phenomenon. And maybe that's okay. And that's not part of the scope of the study, but at least now I know at the beginning that's something I am choosing, and I can be upfront about that. Not just this idea about at the end when a reviewer or somebody says, well, why didn't you do that? It's like, well, I didn't think about it. So at least if you're being intentional, you can, or intentional as we can be in kind of our unpacking. So I think what happens is when we talk about things, we start to get really into the nitty-gritty. And I don't think and we don't give ourselves enough time to kind of stay at the bigger possibilities level. And so I'm going to challenge us to stay at the possibilities level a little bit, and then go deep, and then come back out again and go, okay, do I still like where I've gone deep in my design? So
thank you so much, Cheryl, for being here and for presenting. I certainly really learned a lot and allowed me to reflect on some of my thoughts, and which I think did the same for Jonathan and hopefully for others as well. Thank you again for being a speaker, and hope to see you in person when you're here in November.